It's difficult to imagine modern medicine without infusion therapy. It can be used for pain management and palliative care, as well as to administer nutrition. However, infusion therapy carries risks both for the patient and the healthcare worker. CME Medical is working with the healthcare profession and industry colleagues to help overcome these challenges.
Morning, Ian. How are you this morning?
Not so bad.
Ian Cunningham was diagnosed with a rare form of cancer 3 years ago. He's had major surgery twice. Now he's cared for at a hospice in Blackpool. For patients like Ian, it's about maintaining as good a quality of life as possible. Pain relief is vital. Following surgery, Ian used a syringe driver, which he says was a huge help.
It allowed me to be in control. Being able to just give yourself a beep on a syringe driver eases the pain within a few moments, and that's a big boon. And you can repeat that process several times in an hour, depending how your machine is set up to take it.
Made a big difference.
Made a very big difference to my life and my care.
This is the kind of syringe driver that Ian would have used in hospital. At the press of this button, the right dose of pain relief is administered, and the safety features inside the device ensure that no patient can overdose. CME Medical design and supply these infusion therapy devices for pain relief, nutrition and palliative care. They're fully portable, compact, accurate and above all, safe. Clinicians and patients are asked to give their ideas on how designs could be adapted to improve patient care.
We talk to people about what they do on a daily basis, how they care for the patients, what things cause them problems, and we can obviously then apply our technical knowledge to those problems and hopefully solve them. We can improve safety, we can improve efficiency, which is obviously a big challenge now in the NHS, and we can even help try and enable healthcare in different settings, from hospital to home care. And the technology nowadays can enable safe and effective treatment outside of hospital.
Research and development is a big part of the company's work. Innovation teams have built a wealth of knowledge and feedback.
50% of the people in the business are or have been clinical. They have been nurses at some point. The supply chain guys have been in supply chain for a long time, but they understand what is at the end of what we do. So we focus on that very closely, and we try and build our business and processes around delivering the care that the patient needs. And in doing that, we're providing the clinicians and the procurement people with what they need and the way they need it.
CME's syringe drivers are small enough to fit into a pouch which the patient can carry while they get on with life. And for children, being on medication or intravenous nutrition doesn't need to affect their fun. The device can be packed away in a rucksack. Research proves having independence away from hospital is important to patients. More than 50% of terminally ill patients would prefer to die at home. However, only 35% of terminally ill patients currently die at home. CME's syringe drivers are helping to give more patients that choice.
A patient going home with a syringe driver, we would liaise with the district nurses, and they would come in and replenish the syringe driver every 24 hours, as we would do here in the hospice. The machine itself is very safe and does have alarm devices, so if there were any concerns or any problems with the machine, it will alarm.
For Ian, as soon as his pain and fluid intake are under control, he has just one goal.
It's just taking time to find out all the measures that we need to get in place to be able to get home. That is my intention. I wish to get home.
Living by its motto, to listen, develop and deliver, CME Medical says it will continue to develop and improve safe and effective devices, allowing patients like Ian to enjoy the rest of their lives in comfort and dignity.